So my name's Jude WANJALA. I want to welcome you to this evening tutorial that we're going to discuss about one of the family planning method, which we call it metrocyprogesterone acetate, or commonly known as Depo provera. So Depo provera is one of the family planning method that has been commonly and widely used by so many women. So under this type of profile, we are going to discuss about the mode of actions, its effectiveness, the side effect. We are also going to lose how frequency can we use Depo provera, the frequency of the period between, and we have also to go to use to look about the long-term effect of using Depo provera. So under Depo provera, on mode of action, actually after receiving that Depo provera or administering it, it thickens the cervical mucus of uterus, thereby it prevents the sperms from reaching the eggs. Why? Because it will have that difficulties of running towards the egg because of that thick mucus. It will be prevent them. It will not be flexible for them to move to reach the egg for the fertilization. It also prevents the ovulation. When I talk about ovulation, there will be no production of that egg, and when there will be no production of the egg, hence there will be no ovulation. Also, it acts on endometrium, thus preventing the implementation to take place, so there will be no that implementation. So by acting what on the endometrium. So so many women who use this, they come across the common side effect of Depo provera, of which we call it common side effect of Depo provera. Number one, we have headache. So many women, they complain about headache. We have the hot flushing. We have the general body weakness or tenderness or the malaise. We have the loss of appetite to some women, and we have also the heavy bleeding. And heavy bleeding have become the pattern of this. Why? Because many women or ladies, when they experience the heavy bleeding, they stop to use the method. They say that the method is not favoring them, and also they are not going back to the physician or the clinician to ask the solution for that, or to receive the medication for that, but they stop it gradually, and they end up coming complaining that we have been using this method, this Depo provera throughout my life, but I found myself pregnant. Why? Because you did not use it regularly as per supposed to be scheduled, but you skipped for some time, then you continue. There is no that accuracy. It means when you start Depo provera, just maintain. After a 3-month period, then go and receive another dose, another injection as prescribed by the physician of that nurse who are nursing you. So you need to follow that. Failure to that, you will lead to pregnancy now, and you will come to complaining that I've received the pregnancy and yet I've been using the drug. So what you need to understand, those who are using Depo provera, is that when you experience the heavy menses, you have to go to the doctor, to the physician, or to visit the gynecological obstetric clinics for further guidance or medication. We have some oral contraceptives that control that bleeding, but don't end up just stopping without visiting to see what can be done or what. And remember, during the we want to talk about its effectiveness. So the effectiveness of the Depo provera, it depends on how you are and how you have been told, and the condition that you are when you are receiving that medication. For instance, when you are in menses or after menses, 5 days after the menses, then that after immediately after the injection of that Depo provera, it becomes effective and it works, and it prevents, even if you have the unprotected sex, that means you will not receive that pregnancy. So we are saying for in menses and 5 days after menses, that means you will not be able to receive a pregnancy. It starts its effectiveness immediately after injection. And if you have been given birth, or we administer it after 21 days. So after 21 days, we administer that injection, and it becomes effectiveness. But when you come, you are not in menses, you have not given birth, but you are just common, then we have some protocol or the procedure that we have to follow for us to administer that injection and to make sure that it's effective to you. Number one, we have to do pregnant test. Do pregnant test to, in medical term we call it PT, to rule out if she is pregnant, if you are pregnant or not pregnant. If you are not pregnant now, then we goes ahead to administer that injection. And remember, when we are administering that injection, because you are not within that menses or what, you are within that, number one, you need to know that it will become to be effective after 7 days. That you need to know and to understand. Don't come receive the injection then you expect it to be effective immediately the time you have received it. No, you need to take 7 days. So after 7 days now, you may have that unprotected sex and you will not get pregnancy. So if the need you have to have, if you have to have, for example, for the married couples, because we know that if you are married, it has been someone will say that it is my conjugal right, so he want to have unprotected sex. Now you have to use what we call it barrier method. When we are talking about barrier method, at this time we are talking about using the female or the male condom to protect that pregnancy within that 7. Then after that 7 days, you may resume to your unprotected sex and you will be saved on that. So one thing I want you to understand, the side effect of this Depo provera injection. The Depo provera injection, it has some side effect, and I have told you, number one side effect, you may find heavy menses. Then also, when you use this Depo provera, it may change the pattern of the menses. If you are having it regularly after 5-8, it may delay, or you may receive the menses within the period, so it will change that menses pattern. So when you see the menses pattern changes, then that means it is normal. Don't regret more or start to shout or what. Also, when we use the Depo provera injection, it has some disadvantages. So this side effect may lead to disadvantages, because when when it reaches a time you say that you don't want to use it again, you want to have maybe a child, a baby, or to bear, that means you will stop using it. So it is likely that you may not immediately receive pregnancy. Why? Because most of our patients or our clients, they start to receive the pregnancy after 3 months after stopping to use that injection, to up to 2 years. So when you will not be able to conceive within the period of 3 months to 2 years, then we will end ahead as the medical practitioner to sit down now and to think of another cause that may be causing that infertility. And that's why when it is not between 3 months to 2 years, that means it is not it is not secondary infertility, which has been as a result of Depo provera, but it may be the primary infertility, which have been as a result maybe of something else. So we will end up to rule out the cause of that infertility and see the way to help you. And remember, this injection is administered in 2 sites. Number one, it is on deltoid muscle, which is found on the upper arm, and number 2 is the gluteus, which is found on the buttocks. Those are the 2 areas or 2 positions where we administer Depo provera injections. Depo provera injection, and the frequency of this, you have to renew it within after every 3 months you receive your dose. Every 3 months you have to maintain that, so that you may be on the same side. So the long-term effect of commonly using Depo provera injection, we have some people who have been complaining about heavy bleeding, irregular menses, and all of that I've talked about. So that the sum of it. But we have some also a side effect of prolonged or more time, more period using of Depo provera, and that is low bone density. It lowers the density of the bones, that Depo provera. So when it lowers the density of that bones, then you are prior to the fractures. Maybe when you come in contact to do something that may be very hard, or what it may cause both that. So to our patients who have been long term using the Depo Profela, we advise them to be on calcium and vitamins, because calcium and vitamin will improve on the bone, strengthening the bone and all of that. So we may tell our clients to feed on fish and also the vegetables. They'll improve their calcium level, and also to strengthen the bone and the bone. So what you need to understand is the disadvantage of Depo Profela. You need to know that Depo Profela, you cannot use it and you expect that immediately after using this Depo Profela, I'll be able to conceive. No, it will take time. And I cannot predict, but it may be within 3 months to 2 years. So that's number one disadvantage of using Depo Provera. Then number two disadvantage of using Depo Provera, it cannot prevent you from STI, sexual transmitted infection. You will be able to get that sexual transmitted infection if you go have sex with the affected partner. That you need to understand it and to know that. So when you are going to have the Depo Profila to use it, you also need to be very keen to be faithful to your partner, so that you may not be able to transmit or to receive the STI, which may maybe end up being a problem or another cause that maybe it may interfere with your life. So from that point, I want to say thank you for listening. Thank you for taking your time to listen for me. And I want to call upon that maybe you have an additional message, you may go on comment section and to comment there. And if you have a question you want to ask or you want to be answered, you may also go onto the comment section and you ask your question. From there, we'll be able to reach out to you and to answer you. Thank you for being with me. Let us meet on next session. May God bless you. Remember, our role as health workers is to make sure that you people, you live a healthy life. And as a nurse talking on family planning, it is my desire and my pleasure that you may have a happy family. May God bless you.